Welcome, DLDs. Today we've got a psychologist. I'll leave her to introduce herself.
Yes. So my name is Dr. Davelaar. I work now at the hospital. So I'm a health and rehab psychologist. I'm embedded on the inpatient units, and I'm also starting to do some outpatient work as well. So I'm a newly licensed psychologist. This is my first year of practice, and I'm very excited to be here.
No, it's so inspiring to see, young ladies like
Yes.
you becoming psychologists. Well, we are interested about the relationship between the mind and the
Mm,
body. Us.
yeah. So it's such a big topic.
Okay.
So I'll just start off by talking about, it's there's a very clear relationship between the mind and the body, and we see it all throughout research, all throughout literature. We see it in personal experiences that patient reports. So it's all over. And I think the best examples that I can think of that everybody can relate to is when you feel butterflies in your stomach when you're anxious.
Okay.
That's one way when we're feeling worried, when we're feeling stressed, we feel that in our bodies. It's not just, something that's in our minds or something that's made up. There's a physiological reaction that's happening.
Oh,
So the a lot of people have heard of like the fight or flight response,
yes.
where there's a stress response. There's stress chemicals in the body. There's adrenaline and cortisol coursing through us, and that's really helpful in some situations.
Okay.
Like if we're hiking through the woods and we see a bear and we need to run away, right?
Yes.
We need that stress response to keep us safe and to keep us away from a threat.
Okay.
But in our world today, we actually have a lot of more chronic stressors. We have relationship stress, we have financial stress, we have medical stuff going on. We've just got a whole bunch of stuff. And our bodies aren't meant to be exposed to those stress chemicals and that tension and everything that we experience in our bodies for that long period of time. So that's when we start to see more of an impact in the medical system, how our stress can lead to, hypertension and high blood pressure and, like overeating because we're stressed.
Oh,
That's something that
yes.
I can relate to. We see strokes in people who have been stressed for years and years. It's not the stress itself that causes it, but it can be one of those things that exacerbates things that are already there in our bodies.
Okay.
So it's so important to see how some of these physiological things can kind of wear down our body over time. It can lead to sleep disruption, where we're not getting good quality of sleep. It can lead to chronic inflammation in our joints, digestive issues, a whole bunch of things. So to ask about the relationship between the mind and the body, this is really just scratching the surface, but I think it's so important to think about, emotionally it impacts our bodies and vice versa. Our bodies impacts our emotional health too. So yeah, that's kind of the introductory answer that I'd give you
Oh,
about
yeah.
that question.
All right. Thank you so much. You've touched a lot of topics that we are so much interested in.
Mm-hmm.
You talked about eating disorders, like they are bulimia nervosa
Yeah,
and
yeah.
anorexia.
Yes.
And then you also spoke about sleeping disorders.
Mm-hmm.
And obviously, there is something called the circadian rhythm.
Mm-hmm.
Can you please explain the sleeping disorders?
Yeah, yeah. And the sleeping disorders part of it. I always talk to patients about their sleep habits, sleep hygiene, if you've ever heard of that, or basically just
No.
sleep tips and tricks.
Okay.
But in every interview I do, I ask how their sleep has been, if they have troubles falling or staying asleep, if it's pain that's getting in the way of their sleep, or if it's anxiety and the running narrative of the worries in their head. Trying to get to the bottom of what's getting in the way of their sleep, because we know that sleep is so important for healing. It's so important for emotional well-being. Everybody is grouchy if they're not getting sleep, and they're crabby and irritable, and
Yes.
we're not at our best when we're tired.
Yes.
So I like to make sure that I'm emphasizing the importance of that when I'm interacting with people.
Okay.
Um, so a lot of times people are afraid of taking medications for sleep, like melatonin and
Yes.
other things that can kind of help with the anxiety piece or the pain control. But just kind of talking them through it and normalizing, sometimes we do need a little help, especially during certain seasons of our life where we are particularly anxious or we're going through these health things where we need a little bit of help there. So yeah, sleep is so, so important.
You spoke about sleep hygiene. It's
Hmm.
something new. It's a new term to me and
Okay.
probably to our viewers as well. Sleep hygiene. What more can you tell us about sleep hygiene? Because we know about probably when we have to maintain our teeth, you know,
Hmm.
oral hygiene. But
Yes.
this sleep hygiene, it's a new term to us.
Yeah.
Please explain it a
Yes,
bit
I would love
more.
to. So I have a whole handout on it that I give patients that they can refer to. But basically, it's everything that you would think of. It's a lot of intuitive things. Like, you shouldn't use your phones and your screens before bed and things like that, because that can disrupt our circadian rhythm and the chemicals that are being released in our bodies before we go to bed that usually signal that we're supposed to wind down.
Mhm.
So limiting screen time is a huge one. Um, we always say, make sure that you keep your bed just for the two S's, sleep and sex. So
Okay.
make sure that you're not eating in bed or doing homework or reading in bed or watching TV, because that can kind of create the association between the bed is actually for a whole bunch of activities. I don't need to sleep in bed. So when we get to bed, it's not necessarily that our brains signal that as, okay, I need to wind down. So we make sure that we keep the bed sacred, keep it for just those activities.
Mhm.
Another thing is just creating a sleep routine. So, sleep can be variable. Sometimes we go to bed at midnight, sometimes we go to bed at 10, sometimes at 8. We like to just keep it as consistent as possible so the brain can kind of get in that rhythm with the circadian rhythm that you mentioned. So making sure, you're always trying to aim for as much sleep as you can, uninterrupted. If you know that I can always consistently go to bed at 10 p.m. and I know that, right around 6, I'm waking up, like, okay, let's set it for 10 p.m. to 6 a.m. Let's set that as the goal. Or maybe it's even less than that based on their own rhythms and they feel like I just can't get that much sleep.
Mhm.
We don't want them in bed thinking about, oh, I wish I could sleep. I have so much anxiety about sleep. I should be able to fall back to sleep, because then that can create more feelings of stress around sleep and can kind of interfere in its own way. So, those cognitions can be so important, those thoughts that come into our heads when we're trying to sleep.
Oh,
Because
okay.
a lot of people, when they can't sleep, they feel this pressure and they watch the clock and they see the minutes ticking
Oh,
by and
yes.
they're like, oh, now I need to wake up in an hour and 56 minutes. And
Mhm.
it's a hard thing to break. But even just getting rid of clocks from the bedroom as much as you can. Of course, we still need alarms and things to wake us up, but
Okay.
as much as you can, get rid of some of those clocks so that you're not just watching them all night and creating that pressure around sleep. That can be helpful as well. And then we know things about, like, how soon we should exercise before bed so that we're, exhausted but not too awake from the exercise.
Okay.
No alcohol, because that can get in the way of the sleep rhythms and the chemicals being released in our bodies and our nervous systems and their activation as well. So, I'm just kind of briefly touching on all this. Hopefully, it's not too fast, but I highly recommend people to just research sleep tips and tricks, or sleep hygiene, as I called it,
Mhm.
and just, find out more about that.
Oh, great. No, this is so, informative. How many hours should we sleep for a normal human body?
Really good question.
Yes.
I think it's really hard to say. I've seen different things more recently that, like, men and women need different amounts of sleep. I don't know the definitive research on that, but the general rule I've seen is like anywhere from like 6 to 9 hours. I would say 8 is usually the time that you hear from people as the recommendation. So yeah, trying to keep it around there, I think, would be good.
All right. No, this is so good. And also, I was also intrigued when you mentioned something about eating,
Mhm.
right? I'm talking about women around my age group.
Mm.
We late 30s, early 40s, and our bodies suddenly they don't digest food as much as it used to, and we
Yeah.
suddenly gain weight.
Yes.
And most of us are looking at starting to exercise,
Right.
and sometimes we might overdo it.
Mm.
And is there, like, what can you advise us when we are trying to control our body weights and also, just in general, like sleep and, you know, emotionally, anything that you can advise someone around late 30s, early 40s, a woman. We are probably approaching menopause, some of us. Some do early menopause, some maybe late menopause. What can you advise us?
Yeah. I think the emotional component of that is so important, like you mentioned. I think a lot of us feel like, oh, if I could just lose that extra 5 pounds, if I could just be whatever weight I was back when I was in college or back 10 years ago,
Yes.
then I would be happy. Then all of my problems would go away and life would look so good. But I think it's important to not, give the emotional weight to that, to say, I am not good enough if I am this weight. I think we need to be happy and content with where we're at. And a lot of times we're always like, oh, the grass is greener on the other side. If only I could do X, Y, and Z, then I'll be better. So I think as much as we can kind of like take that narrative away and just say, I feel like I would move better in my life if I was 10 pounds less. This would help me create more of a meaningful life for myself. This would help me feel more like myself instead of, oh, I would look better and people would, think I'm beautiful or whatever it is. But I think actually thinking about the practical reasons that you would want to lose weight, for example, or change your eating habits would be the way to go. What values am I moving towards? Because a lot of times, I had a supervisor who would always say we're either moving towards fear or towards love in any given
Oh,
decision.
okay.
So I think if we're driven by the narrative of I'm unlovable, I'm unworthy, I'm not beautiful if I am this weight or if I am this way, then we're moving towards fear.
Oh, yes.
But if we're moving towards the value of love and, I love my body and I want to do right by myself and I want to feel like myself and do what I love, then that's moving towards, a more values driven life instead
Yes.
of that fearful life. So I think it's so important to kind of keep that in mind as we're making decisions and as we're talking to ourselves, because we can be so harsh to ourselves and, kind of beat ourselves down to a point where we're not even able to, make any changes in our lives because we feel so much shame about them and so much guilt. So I think that would be my biggest tip is just to look at like the emotions surrounding it. Like if we feel, fearful of going out, or we just feel disgusted when we look in the mirror, or we feel like we can't find any clothes that we look good in, maybe it's about kind of recentering yourself and asking, why do I feel this way? Do I feel like I need to be skinnier in order to be loved, or in order to be worthy, in order to be good? So I think that's my biggest tip for
Wow.
people. Yeah.
No, this is so good. Do you hear that, DLDs? She is saying that we either move towards love or towards fear. So, us as dreamers, learners, and doers, we need to decide. There is a decision to be made. You're so young, and you are a doctor.
Yes.
Tell us, how did you become a doctor? We are